Right, it is indeed a very, very good morning to you. Thank you so much for joining us this morning. It is the 30th of May 2023. Tarehe ni 30 mwezi wa 5 mwaka ni 2023. Natumai kwamba uko salama. You've woken up and you're ready to tackle your day. This is the State of the Nation edition of the 30th of May 2023. And this morning we're going to have a discussion around healthcare, the state of healthcare. Of course, you know, in the schedule of, I think the schedule of basic human rights. Healthcare is one of those very basic human rights, and right to health is one of the guarantees of the Constitution, as it is. So we're going to have a conversation around healthcare. Healthcare has continued to have perennial problems ever since independence. I remember, I was not there, but I remember when I read about when Jomo Kenyatta took over the country, some of the 4 things that he identified as an emergency to fix as a new democracy was healthcare, ugonjwa, pili ni ujinga, illiteracy, ya tatu ni njaa, yani ilikuwa gani? Umaskini. Poverty. But then again, poverty is the mother of all those problems. The 4 problems. So maybe if we had fixed poverty, then probably we would have automatically fixed the other issues as well. So this morning, there have some guests as well. We're going to help us to put that into perspective. And we have Dr.Abi Mwachi, who is the chairman of the Union of Doctors. Abi Mwachi is not new here. He was here when he was trying to vie for a seat. And we installed him. So even before we came live, I was giving him a small, some little fear of God on why we put him in position and he disappeared. Hakuwa irudi kusema Douglas, nimetaka kusema asante, nimewaletea mbuzi tuchinje. But anyway, sasa mbuzi amekuwa ng'ombe, ni vizuri alichelewa. Alafu mbuzi amekuwa ng'ombe. Lakini kama kawaida, on the journey, please like when you like, we get to know that you're watching us. And after like, please share. When you share, you give someone else an opportunity to watch the broadcast. On the journey, please like when you like, we get to know that you're watching us. And after like, please share. When you share, you give someone else an opportunity to watch the broadcast. I'm Gerald Bitok, and this is the Tackle, the State of the Nation edition of the 30th of May 2023. And we are talking about the state of healthcare. Aya, tuombe, tukirudi tukuje tuone nane meza kuamka mapema hii. Okay? My dear Father, we come before you this morning. We worship and glorify your name. Thank you for another opportunity to be alive. We thank you for this program and the conversation that we're about to have. Thank you for the guests as well, and the tacklers who are tuning in. May you meet everyone at their point of individual needs. We pray, trusting and believing. Amen. Aya. Sante sana. Munga alito continue all the way from the United Kingdom, Convent, United Kingdom. Good morning. Good morning to my brother. Hope you're doing well. Right on the morning, Jana. Morning, Peter. Good morning. Keipati. Good morning from Upper Hill, Nairobi to Upper Hill, Mambo, VP. I hope you're keeping well this morning. Please, on the journey, like when you like, we get to know that you're watching us. And after like, please share. When you share, you give someone else an opportunity to watch the broadcast. If you also have any questions around healthcare, the biggest conversation, of course, has been pesa, mshahara, is never ending. And kama it's programmed into healthcare. That part of the things that we must always keep fighting about is the salaries and remuneration and everything else that comes with it. Of course, another conflict that has been coming in is who exactly owns healthcare. Is it the national government? Is it the county government? Is the county government doing enough in terms of facilitating healthcare? Should we bring it back to national government? Was national government doing better? Has the national government done better also in terms of devolution? So we're going to get that as well and put that into perspective. Richie FPC, good to see you. Good morning, all the way from Kericho. All right, let's look quickly at the newspaper headlines. And first on the line is the People Daily. Churches move away from investing in schools, hospitals to venture into real estate. Haya. Inasemekana makanisa zimeanza kuacha mambo ya kuinvest kwa shule now and churches. Schools and hospitals now they're venturing into real estate. Interesting time about Uhuru. This is why I backed Raila. So Uhuru Kenyatta has been moving around, of course, as an envoy, and he was in Nigeria and he spoke to African leaders and told them to embrace handshake. Yes. Said a winner does not always have to take it all. And said we have to. That's why we need to have an handshake. This is why back to Raila, ex-president reveals why he opposed Kenya's winner take it all. National politics side of handing over feed in Nigeria. Okay, I didn't know that power had not been handed over. It's been several months after elections in Nigeria. All right, unions in strike threat over tax civil servants opposed bill. Labour movement representing government workers sends a petition to opposition MPs asking them to reject finance bill over housing levy, even as they warn that they will paralyze services if Parliament passes it. That's on page 4. Contentious taxes, housing fund, NAT, nurses and other public sector workers. Unions oppose 3% levy, say it will cause conflict between those with and without jobs. NHIF deductions workers representatives say this deduction will only fund corruption, but want employer to pay a shilling for a shilling. All right, 35% tax on big pay. Workers now want this reduced to 25% because salaries have not been raised in 6 years. Okay. So we're seeing some gentlemen, ladies and gentlemen were demonstrating yesterday. Aji found 17 graft case filing wanting. Okay, story on Aji keeps going on. MCS vote to eject Orengo deputy in Rao. Now, there's a conflict between governors and deputies. And by the way, I've never understood why we have deputy governors, because clearly then they are not doing anything except fighting with the governors, and the governors fighting with them. It's either the governor fighting with the governors. The only successful deputy governor who's been in history is your deputy governor. What's the name of the Kwale governor? The lady.
Yes.
Mwachani. Is called Mwachani?
Fatuma Achani.
Fatuma Achani. Yeah. I think she was the deputy governor, and now she's a governor. I think that's the only success story that we have from deputy governors. So in Siaya, the MCS have decided to kick out the deputy governor. They say they are not so boring. Orengo nataka fanya kazi. So wamesema deputy governor ndo kapumzike. We also seen the conflict that happening in other counties. Meru as well, they are fighting right there. In Kericho, understand the deputy governor is working from home while the governor is working from office. Interesting times. So there are different dynamics in different counties about the fights. And also I've seen Moshisho, who has been here as well, is the chairperson of the deputy governor's movement. Is it federation, whatever it is? They are saying that deputy governors should at least have something else apart from just being a deputy governor. Maybe you have another responsibility. Maybe CC healthcare, and then you are the deputy governor. CC finance, then deputy governor, something like that. Because apparently these guys are just always having government tea and reading newspapers. When at least they're not catfighting the governors. So maybe we need to have different responsibilities or face them out completely. Why do we need them anyway? If we cannot give them responsibilities, why do you want to keep them? County bosses fight at expense of service delivery. Okay, Banco case, Nairobi Nakuru highway loan. Well, okay, barabara nita kujengwa pale. Ruto faces tax rebellion among Mount Kenya MPs. Asla plan elected leaders from deputy president's backyard are an easy lot after attempts to make them embrace new tax measures have fallen flat. Locals instead want taxes reduced to make life more affordable. We are not in the era where the government word was final in this country. We need consultations and not just thumping. I'm trying to read the name of the quoted person right there. Africa's largest economy in hands of Bola Tinubu. Okay. Nigeria's President Bola Tinubu waves to the crowd after taking oath of office as the 16th president of the Federal Republic of Nigeria at the Eagle Square in Abuja. Tinubu took the oath of office alongside Kashim Shettima, who was sworn in as Nigeria's 15th vice president in a colorful ceremony presided over by Nigeria's Chief Justice Olukayode Ariwola yesterday. All right, the picture is courtesy. Akin claims puts Kenya at center of U.S.-China war. Understand Kenya, they say that some Chinese act Kenyan websites. With the insert visa-free entry for Africans. Okay, right there. Is it time for open borders? A financial standard DAR turns up to it on Kenya in EAC supremacy. Apparently, the DAR port has actually overtaken Mombasa port, both in volumes and in facility. Okay, so Tanzania is coming for next. All right, Daily Nation for Gen Z. Dress code is king. They care less about the work, money, or current affairs. Is new report. And actually saw another Gen Z. Gen Zs are crazy people. Now that you're talking about healthcare, I saw something was going on online about a Gen Z who is trying to put in an IV on the palm. And I saw another one the other day. We'd gone to an office in jumpsuits. Gen Zs, we need a wall for them. Media owners won they would lose $2 billion if finance bill is passed. CIMCS vote 38 to 1 to kick out the deputy governor. A fund for every president, then loss of billions. Okay. Mwai Kibaki, Women Enterprise Fund, Youth Enterprise Fund, Development Fund, Land Settlement Fund, Rural Enterprise Fund, National Humanitarian Fund. The Auditor General reported in 2019-2020 that the Women Enterprise Fund was still owed shillings 3.37 billion, out of which 80 million was doubtful at the time. As the funds by Kibaki, the funds by Uhuru Kenyatta Wezo Fund, National Government Alternative Action Fund, GAV, by June 2021, more than shillings 4.6 billion reportedly lost by the Wezo Fund to groups of women youth and people with disabilities across the country remained unpaid despite the expiration of the repayment period. Okay, so President William Ruto as well is coming in with ASLA Fund, an housing fund. Amount the government injected into the ASLA Fund within 2 months of its launch in December, as some 80 million Kenyans were expected to borrow from the initiative. So 9 billion has already gone into ASLA Fund, and people are asking, where is the money? Where is the mullah? President Ruto is continuing a tradition by his predecessors Uhuru Kenyatta and Mwai Kibaki to create funds to provide solutions to socio-economic challenges. However, most of the funds have had duplicative roles targeting the same populations and have also had fundamental problems with the management, leading to losses and wastage. As accountability report shows on page 4 and 5 of the Daily Nation. Raila meets MPs as Kenya Kwanza moves to save talks. Okay. Azimio la Umoja One Kenya Alliance leader Odinga will today chair a parliamentary group meeting of the Azimio. Okay, of course, you've seen the issues of bipartisan talks and what is going on right there. The ping pong. Okay. Looking at Taifa Leo as well, Shakaola Raila habwaga Ruto kimenuka. Koti ya kubaliana na maoni ya Raila kuhusu walali wa rais kuteua kamati hiyo, mbali na kudai kuwa kiongozi wa nchi aliingilia uhuru wa mahakama alipomteua Jaji Lesit kuongoza kamati hiyo. Ukurasa wa pili. So the commission of inquiry on Shakaola has been suspended by the court after Raila went to court. Mahakama yampokeza rais pigo kwa kusimamisha shughuli za kamati za kuchunguza vivo vya kidini Kilifi. Mashoga Uganda kusota jela maisha yote. Ukishikwa pale Uganda kama ni shoga ni kimaumana. Kama maisha yote. Rais wa Uganda atia saini sheria inayoamrisha vitendo vya ushoga kutesa wa Kenya hadi mwaka 2024. Ripoti ya Umoja wa Mataifa UN yasema Kenya, Ethiopia na Syria kuna njaa kubwa. So until 2024 you're not likely to see ugali. Vimada wawili waiba mume wenyewe usiku. Wachumba wali wa polisi wafika usiku na kuponyoka naye. Raila panga mapambano yake upya. Azimio kuandaa mkutano wa bunge jijini Nairobi, Uhuru kuhudhuria. Kwenye sport, majonzi ya Leicester na Leeds United. Okay. All right, Masikos, good morning, Gerald. Good morning to you. D-Square, good to see you. Always number one show. Thank you so much, D-Square. Where? And of course, when you see me looking like this, you see D-Square. Kiniona nimevaa pampa hivi, najua ni kazi ya D-Square. So please add to D-Square Wear and get your designer outfit. Kama wewe ni mtu wa kitenge pia, you can get your African outfit from D-Square Wear Limited from Belgrade. So you can ensure, also know that you can be delivered anywhere. Hata watu wa Mombasa kama Abi, nguo yako inaweza tumanwa Mombasa ifike safi zaidi. So peana measurements, alafu unaweza kungara zaidi. So this look is broadly brought to you by D-Square Wear. Thank you so much for joining us this morning. Okay. I think I've lost some people right there. Anyway, good morning to you, Dr.Abi.
Good morning, Gerald.
Happy New Year.
Happy New Year. Happy New Year to you. Mid-year, though.
The last time I saw you
Mid-year,
I think during COVID, right?
Yes.
I think tuliona mara mwisho wakati wa COVID ama ilikuwa nini? Tangu uko president uonekane.
I was looking for votes.
Ni kama manifesto yako pia ulitupanga. Ulituambia ukikuwa president utakuwa unatembea studio kila siku na tutakuwa tunakula mafuta ya mkate ya Blue Band na jam.
Good to see you.
Happy New Year.
Yeah.
Okay, so maybe you introduce yourself again. Since your last year, the last time you were here, of course, you're not who you are today. So maybe you need to reintroduce yourself.
Absolutely. My name is Dr.Abi Mwachi. By profession, I'm a surgeon, a general surgeon, and laparoscopic surgeon. Apply my trade in Mombasa. Where anywhere else that I can be called. And I'm the national chairman of the Doctors Union, also known as the KMPDU. That is a dentists, pharmacists, and medical practitioners union. Yeah.
You're saying that is?
Kenya Medical.
Dentists,
Kenya Medical Practitioners, Pharmacists, and Dentists Union. Basically all the doctors in the country.
All the doctors. Okay. All the doctors.
Yes.
Okay. Keeping what? Madaktari wanasemaje? Uko salama?
All is well, hopefully. Yeah.
Okay, hopefully. Not even hopefully you're their chairman. You don't know whether they're well or not.
Yes.
You up there. All right. Okay. You also have Mr. George Gibore, who is the Secretarty General KUCO. That's the Kenyan Union of Clinical Officers. Is it? Okay. Good morning to you, sir.
Good morning, sir.
Keeping well?
Good morning. Thank you for having me. Good morning to the viewers. My name is George Gibore, as you have said. I'm the General Secretary for the Kenya Union of Clinical Officers. Yeah, I'm a clinical officer by profession and also a health system manager.
Okay.
Yeah.
And people would want to know, people always wonder, what is the difference between clinical officers and doctors? Maybe you can help us define clinical. Just najua kila mtu ako hapo na dust coat, ama inaitwa aje ni daktari.
Yeah.
What's the difference?
Clinical officers and doctors, our main interest is to actually ensure that the patient get the best service. So our core service, our core mandate is to the patient, which is similar to the doctor, which is similar to the other more than 17 other. Oh, sorry.
Distractions.
Okay.
Yes. Okay.
So I'm saying that we are in the health sector. We have more than 17 cadres, which are realigned to different services that we give to the patient. Clinical officers are primary clinicians. Okay. So our training it was started in Kenya in 1928, and we were trained to work on the field, in the field, actually without any facility. And even to date, we train to use less support from like the setup where we have the laboratories and many others. So ours is more of clinical, engaging the patient and ensuring that you are able to come with the diagnosis for the patient and able to assist the patient without relying to very many other support system. This has now evolved because of the technology that is coming. Now it has changed. We have to continue growing. By that time, it was a certificate which is stopped in 1986. And we started the diploma. We have been training the higher diploma until 1996. We have now higher diploma. We have people who are now professors as clinical officers. Yes.
But it started as
A certificate. That was 1928. Where were you?
1928. I don't know. I think I was just chilling somewhere.
And actually, it's one of the oldest medical professionals in the country. Yeah.
So are you saying that then it was the first medical profession?
I'm not saying this is the first. I'm saying among the first. But of course, I think there were also nurses who were being trained then.
Okay.
Yeah.
So what exactly do clinical officers do?
I've said our main interest is about the patient. Basically, as we attend to the patient, we listen to the patient. Let's take history meticulously, examine our patient, and actually come up with a diagnosis. We are able to do according to our job descriptions. For the diploma, they have to the extent of what they can do, including minor surgeries, because they are trained in clinical medicine and surgery. So there are those who can do, to some extent, according to their training, extensive surgery, including CSs, which is not actually more of an extensive. We have ENT clinical officers. We have ophthalmology cataract surgeons. And we have orthopedics clinicians who are able to deal with orthopedics. And we have close to 19 subspecialties in the clinical medicine, dermatology, pediatrics, reproductive health. So as to that, there are general practitioners, and we have those who have specialists.
Okay.
Yes.
All right.
So, and as you ask, ours is to ensure that we are able to listen to the patient and we treat the patient sufficiently. Actually, we cover 87% of the outpatient in all the facilities in the public sector.
47%.
Yes, so 87%.
87.
Yes.
Oh, okay. Wow. Dr.Abi Mwachi, is that not the same thing that doctors do? Also, I would want to
I
imagine.
would want us to dwell into the subject matter of the day.
No, also it's important for Kenyans to understand exactly because these are the seekers of the services.
I don't know how to define who the doctor is. Because I think it's the oldest profession.
Okay.
Not one of the oldest professions. The oldest profession when it comes to trying to play God and trying to treat and you know, in analogy, I'll make it a little bit light so that it's understood. In analogy, whenever you scored something that is looked at as an achievement in high school, you'll be forced to do medicine, right? And that will be the 2 degrees, Bachelor of Medicine and Bachelor of Surgery. I think this is the longest, this is the degree that takes the longest. Probably just the rival to it will be Bachelor of Architecture. The undergraduate will take 6 years. And by and large, I think the life of the patient, the do or die, is in the doctor's hands. And I think there's much that I can say.
Okay. All right. There's a much you can say. All right. So what is, what do you think, because there have been conversations that have been happening, you've seen your unions as well, that has brought in their stand on a number of things. Of course, regarding what is going on with the country. For the finance bill, the issues on 3% deduction on housing. You saw some of the members of your profession on the streets yesterday giving their opinion on what they think about the state of the nation and how exactly we should be able to move forward. I think we start first of all by the state of healthcare. What is the state of healthcare in the country? I'll start with you, Dr.
Let me just say, we were devolved hurriedly in 2013 so as to mask or push away the attention from what the real issues in this country were at the time. Okay. I will not call it, there was no policy in us being hurriedly devolved at that time. As you might remember, there were transitional laws at that time that we even overtook those laws. And Gerald, I will tell you, as late as yesterday, there were forums in some conference rooms with tea and mandazi and some, those conference rooms that happen in air-conditioned offices, where they realized that there are some functions from the Constitution of Kenya 2010 that have not been unbundled. Unbundled means that they have not been adequately or sufficiently thrown to the counties. By thrown, it's quote unquote.
Devolved.
Systematically. You remember that county government acts became obsolete at some point. Transition to County Government Act also became obsolete at some point. They all became obsolete faster, yes, than healthcare was devolved. So by and large, when you look at that, when you put the cart before the horse, then you expect problems. And that's what we've been having. Ever since healthcare was devolved, we have had a total of 187 strikes for doctors alone. I've not counted what my colleague, Mr. Gibore's industrial action have been, and nurses and the other cadres. And this is within a period of 10 years. Kenya is 60 years old in 2 days' time. In between 10 years, we've had 107 strikes. This is not to say that in these 10 years that we've had very mad people practicing as doctors. There has to be a problem, and the pinpoint is, how it was done. The unbundling of function, it was thrown haphazardly. If the argument that it was supposed to be devolved is won, then the argument that it was done correctly, I don't think it can ever be won.
All right, so that's the state of healthcare. What do you think is the state of healthcare, Mr. Gibore?
I think that when you ask the question, what is the state of healthcare, is a quite specific question. And I want to say that probably when we talk about healthcare, people look at the healthcare workers. Healthcare is a system that is made up of several building blocks. We talk about the human resource, we talk about financing, we talk about now the drugs and also technology. We also have governance, and we have also service delivery as an end start. We also have health infrastructure among us. So what we are looking at is a state of health sector after devolution. If you look at it, for me, I think after devolution, there was some more of an indication like we are doing well, especially focusing on the infrastructure, because that is what politicians believe is development. So every coin they get when they want to invest is to come up with a structure. So we have very many structures, including during the NMS, we came up with more than 22 facilities in Nairobi, but they are not functional. Now, and we dare say...
What do you mean they're not functional? I mean,
not functional, because the people who are supposed to make it functional are not there.
Okay. So the units the president was launching with the DG, what was the name of this guy again? General. So they're not, yes, buddy. Yes. They're not working.
They're not working. If you move around the facility, there is even here around Mutwene in Nairobi where a facility stayed for more than 9 years before it was functional. Because one is that all these things that I have mentioned about the building blocks, it's about the human resource. When you talk about governance, it's about human resource. When you talk about resource mobilization, it's about human resource. Now, having infrastructure without the key people, the key element that can make it function, and without allocating enough resources that now we can be able to do a number of other things, then that will become more of just political statement. And why I'm saying that is that there can never be a good policy than the people who can implement it. So to this extent, we look at people making statement without looking at the people who are going to implement the policies that they are coming up with. Kenyan does not lack any good policy. We have good policy. Now go back to the Constitution. Under Article 187, and we also have Schedule 4, which presumably devolved health, as we do say. And when I listen to the governor speaking, they say health was devolved. But if you read within the line, there were functions that were devolved in health.
Okay.
And these functions are now presumably looked like it's everything that was devolved. Now, there were facilities under the primary healthcare that were devolved, but referral services were left at the national government. Now, what do we call referral? Where does referral start? In any case, what I'm saying is that we fragmented our system and it's not able to work well. And that is why we have stalemate, and the doctor is mentioning about a number of strikes that we have been able to go. We have gone more than 107 strike clinical officers alone, county-based and national-based. And we are selling at another one because as we are talking, we have a strike notice of 60 days, which is going to elapse in a few days. So the issue which is there is that I talked about what the county have been able to do, and we are at an exponential growth where they are not able to do anything now. It is about complain. But Kenyans continue to suffer and that is why we feel like when we are talking about the financial bill, the main issue that we should be focusing is about how to ensure Kenyans can get food that has a big element in terms of nutritional value to Kenyans, and actually ensuring that it has also a big role in health sector. Okay. So to that extent, I feel that the president should be talking about health and should be talking about how Kenyan can get food.
Okay.
That is the main thing.
So are you saying that things are not better either at national government or at county government? Because you're saying both are striking. So things are not better either way.
That's what I'm saying, fragmented, because there's complaint here, county is saying this, and the national government is saying this. Until we have a centralized organization to run the health sector. Because, and I dare say, if you look at page 23 of the Kenyan Kwanza Manifesto, there is where they provided that the Kenya Kwanza shall establish a commission for to run human resource that will not undermine counties. That's what they said. What is that?
23.
Because we presented then, because during that time the unions ensured that health became a political agenda, a campaign agenda, and we presented the issues that are bedeviling the health sector. And we were able to mention some of the issues that has attributed to this numerous strike and industrial action that actually disrupt services to Kenyans. And that is why they proposed to come up with a commission. So it's unfortunate because when the president talk about this, the county gags because that's where they do corruption. They gag him not to speak. And I dare tell the president to continue engaging because it is us who are the practitioners who knows where the shoe is pinching. Yeah.
Okay. All right. Dr.Abi Mwachi, what are some of the issues, what are some of the problems, what are some of the complaints, or what are some of the grievances that are coming out of, especially healthcare practitioners? Because those are the people that speak.
First of all, just to pick up from my colleague, Mr. George Gibore, you know, healthcare is supposed to be devolved in a systematic manner. Yeah, then we unbundle one function, then go to the next year, we unbundle another, right? Systematically, that's where we had transitioned to County Governments Act. However, being as it is that we were in a tumultuous political year in the year 2013, and let me step back a bit and say there are many ways to implement a policy, right? One of them is a proper way, as that if I had a policy, like in this studio, I'll have a policy that I want to make this studio prosper. Then I will also try and have a policy that will try to make the employees of this place, right, know that I'm boss, yeah? What happened with healthcare is when the national government in 2013 or thereabouts saw that the county governments were asking and asking and asking, what the national government did is that they threw healthcare at them and disbanded all these other transitional to act, transitional to county government act and all those things. So functions were transitions, quote unquote, without the proper modus operandi towards the counties, you get what I'm saying? And as a result of that, the counties were ill-prepared. The counties were ill-prepared. There were not enough laws. There were not enough personnel. There was not proofreading. So what happened eventually is that in as much as the counties were not able to implement some of the policies that were originated from the previous runnings of the government, they were still running on the wrong lane in an attempt to show that they could. What I call this kind of implementation, and I'll keep on referring to it throughout this show, is tantrum-based policy implementation. This was a tantrum-based policy implementation, and it was potent to fail, and it has. The proof to it is counties like Kisumu, they're returning their biggest referral hospital to the national government. The governor of Mombasa is on record when he was member of parliament trying to draft a bill to return Coast General back to national government, right? These are the alligators in the water. When they come out of the water and tell you that the crocodile is sick, don't doubt them. Don't. Yes.
Yeah. You know what he's saying? Let me mention about what he's saying is that those counties are actually doing the right thing because the counties are not supposed to run any referral facility because, you know, like if you go to Kisumu, to Nyanza region, we have now the Kisii referral facility, and then we have that Jaramogi Oginga Odinga referral. But all the other counties around those regions depend with those facilities. And there is no allocation of resources that go to those facilities to cater for other counties. Because the estimation is as per the county. Okay. And that is what the constitution envisaged, that the referral services remain with the national government. Now, every county is running to come up with the referral facility. Is that constitutionality? Now look at what I've mentioned in Article 187. It has given them that mandate to return those services. They are not doing anything wrong. And actually, I know that the governor for Nyeri had expressed that the same thing more than 3 years ago, who is still there. But the national government then did not take it up over. We want to encourage the counties to do that. Because and if you look at Article 43, if I'm not wrong, it is the state that has been given mandate to ensure that Kenyans get the services they need in the quality that it deserves. When we talk about state, it means that it is a solid thing, it is a packed thing, it is one thing that need to offer services. But unfortunately, where we are is that going by what Dr. is saying, that we devolved services without proper consideration, and that is why some of the county pretended to be taking over. And I can actually give credit where it is. And I've said that they were able to get to increase a number of structures. And looking by the WHO report is that Kenya has attained the required infrastructure. That is hospitals that we require. We have the right number in terms of the population density versus the infrastructure. But when you go to human resources, we are doing very low. We are supposed to have together around, now currently according to the current review, is 45 healthcare workers to 10,000 population density. All healthcare are put together. But we are doing less than that. We are doing close to around 13. So when will we reach there? Because if you look at the investment again, which is there, because the national government is not prioritizing that, because it is them that has the resources. Now, we last year, the last financial year, we spent 550 billion, which was estimated to be around 6.7% of the national budget. But this year, the projection is that we are reducing it to around 3.2, 3.4 there. Which means priority again has shifted, because that time it is COVID that was necessitating that. Yes. Now, if you look at the Kenyan government, which has signed the Abuja Declaration, they said they were to allocate how much? 15% of the national budget. This will be enough to employ enough staff. It will be enough to ensure that there is supply of commodities. It will be enough to ensure that healthcare workers are promoted and motivated to work. So to that extent, we feel because of these crystallized services, disintegrated services, then the national government lack objectivity in terms of putting things together in the health sector. And the county are not able to consecrate anything about it. Now, when we make when we push them to do the same, they look at the unions as anti-government and anti-county, and against the county, which is not true. Because for us, our interest is the common people who are not able to get services because of this fight between the national government and the county government.
Okay. Let me paint a simpler picture, and I will pick it up from just simply Abuja Declaration. Kenya, without coercion, no guns on their heads, went to Abuja, Nigeria, and put pen to paper and signed a declaration that they will increasingly, it wasn't to be drastic, increasingly put the budget and increase it to 15% towards healthcare. Now, this is where the lopsidedness comes in, Gerald. That here we are, a country that has this very good manifestation of a constitution that involves healthcare. And it doesn't involve healthcare alone. It involves agriculture, ECDE, housing, and so many other things. And how much is the national government giving to the county governments in total, in percentage? 15%. It's not 30. So health and all these other functions that are devolved are all lumped up to 15%. In essence, that 15% should be the target for health. We should be now nearing close to 10, given the years that have already lapsed. But
that is health alone.
Decades later, we are lumped up together with very many sectors, and they're told, now you're devolved. This is why I'm telling you it was drastic, and it was tantrum-based politics thrown to the counties, and you're given 15% to manage everything. What I will tell the governors is that if they look keenly, yes, with a keen eye, correct their prisms, they will know that they're being shortchanged, and that the doctors were telling them that healthcare should return to the national government. Actually, they are friends and not enemies of devolution, because this will give them more money, more coins in their hands to tackle problems that face Wananchi. Another picture that I want to paint, Gerald. We recently had a child who had a fork djembe stuck in his head, quite unfortunate, and may his soul rest in peace, who traversed counties all through Thika to Kiambu and to Kenyatta National Hospital. Now, paint the same picture, because misfortune does not choose only those patients who are close to Nairobi. Pick a picture of a child in Wajir Mandera. Are you going to tell me that Wajir Mandera, in their priority list right now, there is allocation for training of a neurosurgeon?
At all.
Whereas the total number of doctors in those counties, including Vihiga, let me not just pick this and Vihiga. I will also mention a county like Busia. Yes, their priorities will not be towards, right, the training of a neurosurgeon, of a cardiothoracic surgeon, that's a heart surgeon. Probably in their own estimation, what
the
I
list
see,
of priorities.
in their own estimation, what they see, they want someone seated in the hospital with a white coat, even if it's a butcher, for the cameras. That is what I think. If you leave...
Is it as bad as you want to paint? Are you saying that Kenyans who just want anybody in a white coat, even if it's a butcher, really?
I wish I could paint. Because it's worse than that.
Okay.
It's worse than that, right?
No.
If you leave the decisions solely to counties that are cash-strapped, I'm not saying that they're bad policy makers, they're bad implementers, they're bad through and through, but they're cash-strapped. You're giving them 15%, which is supposed to be just the health allocation. But you give them 15% and telling them, yes, now do everything. Do development, do ward fund, do agriculture, do ECD. Come on. Something will eat the fun badly. And that is what you're seeing right now.
And that is healthcare.
And I don't know why they're not saying it. They were not given money for healthcare, in my own estimation. The money for healthcare remained at Afya House.
So in short, healthcare was never devolved.
It was never devolved. It was a tantrum-based policy, and the counties are running away with it like it's beneficial to them. Let me tell you what the counties are doing right now. I'm an employee of a county. My salary comes from the national government, goes to the county. Whatever the county is doing is my salary. I don't know.
What do you mean, don't know it's your salary?
But the county is like an ATM. They cannot alter it. They cannot do anything to my salary. So why are they insisting on it? It's like an ATM, but they're insisting on it.
You should just get your money from national government.
It's coming from national government to the county, and the county hits me. It's something that's close to
Conveyance,
a bad word called nonsense.
Maybe the county is your lawyer. They are doing conveyance of your salary. But then again,
the quarrel that we see between the national government and the county government is a reason enough why we need to think and rethink on what happened, so that we are able to correct the mess. And we have been raising these issues. The bad thing is that the politician never take this seriously because of they want to speak what is what they feel is good for them. And why healthcare workers under the counties never get their pay in the same time that the national government do, because as we are talking about today is on 20. National government employees are already paid, majority of them. County employees do not know when to be paid. They go a month, beyond a month, and even 2 months. And that is the most...
It depends on whether the county has paid some brokers at the county, right? Called pending bills. Don't think those pending bills are anything important.
Yeah, they misappropriate those money.
Yeah, like have you done pending bills? You've not done pending bills, and doctors are not paid.
Yes. So priority shift, as the Dr. explains, that these resources, especially for health, cannot be used for anything else. Now they take this money, use it to pay the appropriate, or rather the right people, their people who probably have done their tenders. Because in any case, that's to mean they occasion that and they get, because that's where they do business. Let me see tenderpreneur things. So when they do that, they fail to pay the healthcare workers. They forget to purchase drugs to be in the facility. They fail to actually ensure that we have reagent for laboratory to function optimally. And that is why Kenyan to date, if you look at the trust percentage, Kenyan do not trust the lower facilities. Why? They're not functional. Okay. They are not functional because if you go there, there might be a healthcare worker, but there is no drug, there is no laboratory. The laboratory is not functioning. So you are told to go and buy or go do this test outside the facility. So why should you go there? So they bypass this facility going to a higher level, which means that we have a system that actually acknowledge failing. That is a system failing. What do you say of a stage of a Kenyan, a country like Kenya, that we have a preventable condition like cholera? Every now and then, as we're talking, there are people who are admitted in Homa Bay because of cholera. Nairobi here, cholera has been running year in, year out. The system is failed. It is not connecting. So until such a time, and we are saying that until we rethink what we need to do so that Kenyan can be really a developed country that is really focusing on other things rather than much timing, we have really to listen to each other and move away from politicizing the issues of health, like the way the governor wants to do, because healthcare workers have suffered. The healthcare workers today have suffered than any other employee. If you look at what has happened in Kirinyaga, healthcare, the governor just decided that I'm terminating you. There is orders against that. And she does not even, the Public Service Commission has actually pronounced itself because when you are fired under the county, you can appeal at the County Public Service Board, at the Public Service Commission. The Public Service Commission has ordered those people to resume duty. But those people are not at work because the governor doesn't want it. Okay. And he feels that these people, because they are in the union was fighting him. Unfortunately, those people are suffering and they are supposed to be at work. The county does not have enough staff.
So the people end up also suffering.
Yes. Okay. So this is some of the problem that we feel. And it's not the same, the only county. Look at what was happening in Laikipia until the current governor came to correct. We believe that if there will be another governor in Kirinyaga, we'll correct that mess of Waiguru. But they continue speaking about devolved services, and yet they don't ensure the services is offered as to the extent that. Because if you do this, these healthcare workers, you are torturing them. They are sick. You are affecting them mentally, and you expect them to be upright and offer services to Kenyans? No, I feel that you have to listen to your workers. If today you mistreat your house girl, when she reacts, you never know, because they cook your food. Yeah. And they do a lot of things in that house. If they decide to mess up with you,
and you are gone.
Because it's the people who are inside. So the healthcare workers today, they feel that they need to be given a chance to explain how they need to be managed. Because the best thing is that there are people who are giving us the name or describing what we are supposed to be instead of us saying what we want, so that we can streamline the health sector,
Okay.
and ensure that the system is really coordinating, speaking to each other, and functioning.
All right. Okay. Nyakwera Augustine, Gerald Bitok, those are silly, stupid ideas of Kenya Kwanza to finish devolution. This on returning healthcare back to national government. Cleopatra Ellis watching from the USA. Interesting. Maureen Sambo, healthcare ought to have been reverted long ago. Devolution is proving to be a big scam. Jane Mwombe, good to see. Good morning, Carbon Sarah, watching live from Eldoret. Ata ruta asai niyo ya Mashoga, Kenya. Okay. Murege Mashoga. Okay. All right. Jonathan Oriki, commendable job at Super SG Gibore. It's Captain Alan. Hi, good morning to you, Captain Alan. Tweya Onsoti, good sentiments there, my chairman, Abidan Mwachi. Jane M, what happened to the health officers who used to check hygiene in eateries and viwandaskis? Okay. But even before we get to that as well, to get deeper into the debate. So you've, as Katibu and also the chair, you have spoken very strongly on the fragmentation of healthcare. That we have some people in the county government, some people in the national government, and there seems to be a problem with synchronization of both duty and delivery and also money. Like you're wondering what your money is doing in the counties. You should get it from the national government directly. So where would you that? Where would you guys rather be? Where would you rather be?
This life, no balance.
If you have to be asked.
So let me tell you, on a very serious note, we have to learn from history, and history is replete with examples. And COVID gave us a test case on what functional healthcare should be and what a non-functional healthcare actually is. And we have we have a dichotomy of healthcare systems. One is Spain, the other one is Italy. Italy was burying people across the road. Remember, the mortality in Italy was so high that they couldn't keep up, not with the hospitals or the places to hold the dead bodies, but the places to bury. Spain had devolved healthcare to an extent until a certain point where just in the nick of time, we could call it the 11th hour, they returned it to the national government, right? And the mortality rates between these two when COVID hit was clear as day and night. Italy had very bad mortality. Spain had a good mortality. This is the point I'm trying to drive. In one unitary, solitary state, we can't have healthcare run in 47 different ways. You can, 48. You can imagine yourself if police was run in 48 different ways, if the military was run in 48 different ways, if education was run in 48 different ways. Like you go to Homa Bay, they have CBC. Yes? Then you come to Nairobi, they have 844. Then you go to Kirinyaga, they have the British system. I mean, that's something that doesn't make sense. Right? And that is what they're trying to tell us, that healthcare is supposed to be run in that way. If I'm wrong, let them bring proof to prove otherwise. But, I mean, I'm coming from that system. I know what it is. I know the counties are running without policy. If I was to be a literature person, I would say this is akin to a man running downhill with the mouth wide open, the eyes closed, and running at a very high speed, in a very steep hill. That is Kenyan healthcare.
They rather have their mouth closed.
Let me put another context what Abi is talking about. Why do we have the World Health Organization? And I want to start, reason being is that health is a public good, meaning you cannot put boundaries for health.
Yes.
Health is something that crosses boundaries. Any danger for Kenya is a danger for any surrounding countries and to the world. And that is why it needs an organized system to address any danger, any emerging and re-emerging conditions and issues that affect the people. So to that extent, when you hear a county saying that this is my, there is nothing like that. I am traveling to Mombasa probably tomorrow, and then you find that you need services there. How do you limit the people who can get services there? So that's why we are advocating that we really need a central body to run health, which can easily coordinate and implement policy in a uniform way. Not the way counties claim autonomous, where they don't have. And indeed, I still go back to say that when I ask the question, like, where does referral start? When this, now we are calling them, we used to call them health workers, community health frontiers. We changed it to community health workers, and now I think we have changed it to the other name that I don't even remember. When they walk to that home and find there is a sick patient who cannot do what do? They refer that patient. That's referral. That is a bigger, referrals start from the household to now to the mainstream system. Okay. Now, where you break it, then the system of referral fail. And the responsibility also share, because who will you ask that these services was never offered? So we want really to bring this service together so that the national government take full responsibility of allocating resources, employing healthcare workers, promoting healthcare workers, paying them at the same time, and ensuring that they are actually motivated to work. Looking at what Abi was talking about, 47 style of governance, which has demonstrated inability because of a lack of capacity at the county to handle the human resource, is a key thing that we really need to look at and resolve. Then, if that is not enough, why did we form the Council of Governors, which is not on the Constitution? The governors realize that until they work, they must have something that coordinates their services. What is so wrong for us to have a coordinating body for healthcare workers? And be able to say, no, this is, we do not have maybe like the way they are now desiring to have a body. I can see the president was launching. Was it launched? This KHH RAC. This body, the mandate that the president was speaking about that this body is going to do, it's not there on the act. On that act, I was participating in the in the establishment of that act, and why we were pushing and we established that is because the counties were averse, or rather refused, to have something called the Health Service Commission. Okay. We wanted to establish a body on that act that can handle the human resource aspect. Now, because of that push and pull, we ended up establishing a number of two bodies. There is the KHPOA, and there is that KHRAC that the president was launching the other day. Now, we had anticipated that this can actually probably be seen to be functioning so that it can be given more mandate to come up like what we call now the commission to handle the human resource aspect for the workers. Okay. Now, the president is now saying that this is going to coordinate the HR aspect in the counties, and including ensuring that there is equitable sharing of specialists. They do not have that mandate in that act. They don't. Okay. They are saying, actually the main thing they can only do there is to come up with a policy for training of specialists, which is already there. That is what they say. And they say they keep registers of all the healthcare workers, which is already happening with the other regulatory bodies and also with the KHPOA. So that body, for me, is one body that probably might not have the real function to work, and might not have that vigor that the president is thinking about, and probably the coordinating mandate that he has been projecting about. Because laws are not, they are meant for us. we are not meant for the law. It is the law which is meant for us, so that it suits the situation that we have, and correct the situation that we have, so that people can have services. And the government must be defined by the service it offers to the people. Once service fail, that government should not be in place.
Okay.
So the president must rethink his probably position in terms of ensuring that we can be able to achieve the UHC, which is a good idea. Okay. But unfortunately, if it remains a boardroom thing, the way they always do, the healthcare workers who are on the field are not able to fully participate and ensure that Kenyans are involved. Then for me, I just see it as a mirage.
Okay, all right. If we get back to Chairman, Brenda Ongalo, streamlining healthcare is one of the low-hanging fruits the president can tap on instead of the misplaced housing levy. This is clearly not a priority to Kenyans right now. Rebecca Chanya Mwakalu, watching from Taita Tavera. Good to see you. Rebecca, good morning. Collins Ngano, Kiproti Gilbert, Nakuru student. Thank you. Brenda Ongalo, good morning, Gerald. Healthcare is such an important function to have been hurriedly devolved without proper structures. We instead devolve corruption and mismanagement. Cleopatra is watching from the USA. All right. So I had to go back after you mentioned about the Kenya Kwanza report. I've gone the Kenya Kwanza manifesto. That is a plan, and I've gone to page 23, and that is point 333, nationalizing health insurance. I think you have it on the screen right there, and. The National Health Insurance Fund is a mandatory basic health insurance cover, which should be applicable to all Kenyans. And our administration, the scope and strength of NHIF will be expanded to be the sole health insurance provider in Kenya by the year 2020. All private medical insurance cover providers in Kenya will have until the 1st December 2024 to wind up operations in the country. Will expand to accommodate national population burden and provide Kenyans basic health insurance and other packages for them.
Now the see the spread.
I don't think this is what
has reduced. If you check the form, you'll find that the spread has come down.
Okay. But page 24
There's a page where they say commitment.
Page 23 talks about poultry.
Poultry?
No.
23 is a plan.
I don't know which one you have.
24 talks about healthcare.
There is somewhere you'll see Kenya Kwanza commitments.
Commitments.
Yes.
Oh, okay.
And
This is what it is.
Where it highlight the specific.
Let me just highlight it.
Yes.
Yes. I think it was a political statement, but whatever a political statement can be, we take it with connotation of truths, because I'm a scientist. Yes, a doctor is a scientist. So the stories about political statements, when you mention it in line with the work I do, I will take it seriously. Hook, line, and sinker. Okay. Right? So you totally, his heart was in the right place. Whoever was writing that manifesto, that in as much as devolution was a good idea, okay, I still think it was a bad idea. What the problem was in the manner in which it was devolved. And now the Kenya Kwanza administration was to come in and arbitrate. Let me tell you why they took that middle position. Because I've attended several sittings where governors are...
And you're even in the launch, so you should be able to tell us more. I saw you somewhere.
I was.
I saw you somewhere within the launch of that healthcare program. So Katibu, you should be tackling him. You should be tackling him.
Let me say what is clear. You're putting me in the spot. I was in the launch of all those manifestos.
You also made to clear.
I'm a political. Let me tell you, when you are in a forum when governors are, they will be sleeping through the entire forum. But when you mention Health Service Commission, they all wake up and say they're opposing it, right? That is the only moment they wake up and they say they're opposing it. That is what now when they came up with this idea of KHRAC, what's supposed to be, what it's meant to do, is to take care of this unit called the human resource in itself. And that is us, leaders being selfish.
Okay.
Because in the actual sense, Gerald, if we sat in this room and continued this discussion, we'll also be running on a very wrong lane. If the question was, and the answer is yes or no, is healthcare devolved? And the answer is yes or no. If you answered yes, you'll have failed that exam. Healthcare is not devolved. Healthcare is a shared function. And to be the agent provocateur or the devil's advocate, I would say that the problem with the misgivings that we have with healthcare emanate mostly from the national government. And it is that national government to sort it. Because national government has abdicated its role according to Schedule 4 of the Constitution. What does Schedule 4 say? Well, we have it clear what the role of the county governments is. Take this facility, as my friend Gibore was saying, that the referral facility. A good man, Okia Mtata, went to court and even appealed. We lost that case there, what referral is. Yes? So you are all referral facilities. We are all not referral facilities other than Kenyatta and Moi Teaching Referral. If we were to follow the Constitution as it is and understood that healthcare, clearly, and as you were saying, Dr. KUCO is one of the drafters of the Constitution, is meant to be a shared function. The county governments are supposed to deal with the facilities and the management, and you know which role is more important than that? It's policy. Yes. If you're renting an apartment, you will live in that unit according to the policy of the owner of that apartment. But to date, 10 years, is it 10 years really? It's 10 years down the line.
10 years down the line, yes.
The county government are running their own policies in training. And in as soon as yesterday, as late as yesterday, they're somewhere holed up in an AC-conditioned room with tea, samosas and everything, trying to take even more, including licensing, because the national government does not seem to be keen on taking up its role on policy. And if they don't want to take it, we will force them to take it.
We'll force them.
We'll force them to take it. Because the conversations that were happening yesterday have made our members really angry, agitated. We are keen, alert, and ready now.
Yeah, we want to sensitize the counties that they must be aware that what we are singing today, or rather saying today, started immediately after devolution. Remember, that was the first strike. We went on strike refusing to, in the manner that this was handled, the devolution of health sector was handled. And this is not going anywhere. It will be here. We will continue sensitizing people until such a time this will happen. That is when the answer comes, even if we are not the one who are leading these unions. And I know that this is now the talk of many Kenyans. And that is why when we see the president being misplaced by just pushing something that people are crying. What is the so urgent? You know, when you don't have enough money, what you do is prioritize the issue. What is it that I need to do? First, I must eat so that I can do the other things. Kenyans are struggling, including healthcare workers, are struggling to put food on the table. And then you tell them, I want to prioritize your house. Now, leave alone that. Then again, people are sick. If you look at that document that Dr. Abi is talking about being a political statement, we want our politicians to be responsible for what they say. Once you give a statement of commitment to Kenyans, then unless you are taking us for full, you should be able to do that. Why is it that when the president went to his state house, immediately he drafted very few things which are politically sounding good to him, and it was taken to parliament for consideration for amendment of the constitution. And he left this one issue of the health out. Why? He felt that the governor might be fighting him. That is what he felt. So he avoided the fight, but he picks the fight with the opposition. Because when you bring things that the opposition are not feeling, but why is it that the most sensitive things that any Kenyan will benefit from, you are not focusing on that? We really need to ask him, because the advisors are there, and I know most of the time they listen,
They talk with Mwachi. You should send Mwachi.
the current people who are advising it.
You should send them.
Yes, you might be going to State House this evening. Now that
Even after the show, you can look at the suit he has.
My members whom I represent, these are live shows, isn't it? So there's no editing, isn't it?
Yes.
My members whom I represent and whom I have to be very loyal to. I'm a very loyal man, by and large.
Yes.
If I'm going to State House, it will not be to listen.
Yes.
I'm not going for lectures.
Yes.
I am done with my undergraduate and postgraduate.
Yes.
If it's a mutual conversation,
Yes.
whereby we do agree that we can edit a few things, dot the I's, cross the T's, from my end, then I will. But if it's
So what are you going to talk about today?
If it's a lecture session, I will not attend, because by being the chairman of the Doctors Union, I am supposed to represent not just my members' sentiments, but present it in their emotions, in their tone and tenor, right? So I will not attend a lecture session. Anyway, and one thing we should know, that there is no big man in this country. Those days are long gone.
Yes. So indeed, by the way.
So what is it about today? What's the meeting about today? Or you are not going?
I am not aware of any meeting.
Okay. You're going somewhere.
I think fixed. But it's okay. So
I'm not going anywhere.
Yes.
I'm here.
So what we know is that really, some of us, we have the feeling that if we have to architecture and push and ensure that our politicians get things right, is we have to start with them. So we started with them during the campaign. But unfortunately, is that the optics change when people are in office.
Okay.
I was on the very table when we were doing the drafting of this manifesto of Kenya Kwanza. So at least I know a number of things.
You can speak with authority.
Yes. So what I'm saying is that we really need to tell the president not to wave away from what he promised Kenyans.
Okay.
And indeed, as you had one of your viewer, sending a message, is that this is the low-lying fruit, which actually can give the president one of the key things that he can be remembered with. If he can only focus on issues of health, is the low-lying fruit. Because Kenyans are willing, the healthcare workers are willing. It is only a few politicians in the names of the governors who are not willing. Including senators have spoken about this, and they feel that really we need to do something about it. And I do not know whether they really understand what we are talking about, because they are not professional in the health sector.
Okay.
And that is why probably being given the advantage of being the first people implementing the policy, that's why they're misinterpreting and actually mishandling the health sector.
Absolutely not. Absolutely not. They are not misinterpreting.
Deliberate.
They are not ignorant. And I have enough examples, though I'll just quote one. You know, health is only devolved when it has problems. When it comes to tenderpreneurship, good case in point, managed equipment scheme.
Yes.
And there's another one.
Actually, I've seen close to 30 counties have failed.
All of them, all 47 counties
Failed
are
equipment.
meeting to the tunes of 98 million shillings, right? To a scheme called Managed Equipment Scheme. The reason why the 9 former provincial hospitals are not getting a conditional grant is because that money is going to Managed Equipment Scheme. Yes, we have that document from Senate. You have read it, the 400 pages document, full of knowledge. So national government sat in State House in the previous regime and decided that the healthcare is only devolved in as far as Dr. Mwachi working at Coast General Theatre is concerned. But now when it wants to do tenders for MRI and CT scan, 2 facilities that don't even have electricity. Yes, it did those tenders and even supplied equipment for doing heart surgery in remote areas that don't even have a surgeon, right? Now, it's coming. There's another scheme coming now for CT scans and all over. But now when it comes to management of human resource, they're acting blind.
That's where they draw the line.
Deaf. See no evil, hear no evil, speak no evil. So they know what they're doing, isn't it? Yeah.
So what I said, and I must be able to qualify what I said, that it is deliberate. I heard the chair of the Council of Governors of the recent past reading a statement where he was saying that there is a coup that is being done to take away. They said that health is devolved. And that is why when we talk about health being devolved, and we have really made reference to Schedule 4 of the Constitution, which has given the functions that were devolved. Okay. So every county is really working very hard to ensure that they have what we call the referral facility. Instead of concentrating on the primary health services, which is preventive and the promotive services, mainly. Now, that aspect of preventive promotive, which is supposed to ensure that we sensitize the community and ensure that at least some of the condition. Let me take maybe go back so that I put this into context. 70% of all admitted cases are preventable cases. So if we were able to focus on prevention, at least we prevent even 35% of the 70% that is, then we'll reduce the cost of admission and actually ensure that Kenyans are able to celebrate that services. Now, because they are focusing on areas which is not their Madin, that is why we are not able to ensure that we maximize services in the primary services. Okay. Now, I have seen many of the counties always what they focus on, and even the where they have put money is about the referral facility. If you go to those like Kisii referral facility, it takes over 80% of all the resources to that county. Okay. So leaving all the other facilities without nothing to spend that small amount that is there. Oh. If you go to that referral facility, it has all the human resource, probably to a larger extent, close to 70% of what it requires. But a majority of those facilities which are at the health centers and the dispensary do not have do not have those resources. Now, what this means is that these cases where we ought to have actually detected cases early and actually come up with intervention early enough, then we wait until these cases are complicated. So what end up? Admission. So is that a real working system? Is a failed system? Okay. Now, and in that context, we really need to encourage people to do the right thing. When you do the right thing, it is easy to canvas to the next stage. Right. But the unfortunate thing is when we complicate ourselves, looking at like everything was devolved and you want to do everything for yourself, and the national government keep on holding, because the constitution is that devolve service and let a fund follow services.
Also, devolve resources.
Yes, but who has costed services?
Okay. I'll chip in. We're not painting one side as an angel and the other side as a devil.
Very true.
What you say, that our ni Warabu wa Pemba, wanajuana kwa vilemba, right? The national government and the county government, they are focused so much on tenders that they've forgotten the main job. You get? What you're telling the counties is, open your eyes, governors. You are never given money for health. It was never sent to the counties to date.
It was never devolved.
The money was never sent. You're given 15% of the national budget, while 15% is supposed to be for health alone. That was sent for so many other amorphous functions, like including painting the road going to prisons. Right? Well, they don't want to hear that. Okay. If they joined our fight, then they will speak Nyong'o's language, and we'll take the biggest referral hospital back to national government where the money is, because the money is enough years, even though they are refusing to pay our interns and posting them. For us, as unionists, we want our work to be easier. We want to fight one person instead of 47.
Okay, so it's better to handle one. All right.
It's better to
5 minutes. I'm going to stop at the hour.
Tufinye moja tu badala ya
That is right what Mwachi Abi is talking about. Because if you look about the recent past, which the discussion has been around the Mafia House, I don't know. Yes, the KEMSA thing and always, and it is a history. Look at since 2013, every year we have scandal coming out. And we are not saying that they are the best, but we are trying to say we need a centralized body, not per se what they are saying about. And that's why it was a commission. You know, like the TSC, if there is something wrong in the system, you'll know where to go very fast. Okay. Now here is where you can't even know where to touch, because you touch the Ministry of Health, they will tell you county.
You touch the county, they tell you.
County, they tell you national government. So where is it?
Okay.
Najua ile mdudu yenye ukiguza hapa naenda pande, ukiguza pande anaenda. Huyo anakaa kama nyoka.
Millipede.
So that's what we have.
Just centipede. All right. 5 minutes. 5 minutes to the top of the hour. Now, finally, of course, the biggest conversation in the country right now is about the 3% house levy and the finance bill. And of course, I've seen you guys have weighed in. Oscar Mbaya, each county has unique health peculiarities. The only way is to increase funding to counties. Right. So, what are your thoughts on the 3% housing levy and the finance bill 2023-2024, Dr.Abi Mwachi?
Really the housing levy. As a union KMPDO, you know, they are my employers primarily, and I represent them by virtue of being their chairman. We did the virtuous task of asking whether there's a doctor who doesn't have a house, and there was none. Yeah, we asked again whether there was anyone who had forgotten to answer that questionnaire. Is there a doctor who doesn't have a house? And we actually confirmed that there is no doctor who doesn't have a house. Then I said, let me now confirm what is these houses that they want to buy for my members. I'm speaking for our members. I'm not the president of this country. I just represent my members who are doctors spread over the country. I said, I was listening to the peers saying that they want to deduct money from my members who have sent me to represent them, and that money will be at houses, ostensibly not for doctors, because I can confirm today, madaktari wako na kwao. Yes. It was, now it had shifted from building houses for my members. Now it was for creating employment. And I was tasked by my roving mind to ask myself, what kind of jobs, I mean, in all it's, it can be good Samaritan as it takes to contribute my 3% to create employment. What kind of employment will I create? Will we be hiring architects or engineers to build those houses? And the simple answer that came to my mind is no. We are contributing this 3% so that we can hire people for menial jobs. And by extension of that, what that meant is there is absolutely no difference between creating jobs for the housing funds, because that is what my money will be doing, creating jobs for the menial jobs that will be done to build 3-bedroom, 2-bedroom, 1-bedroom apartment that I will never occupy, and kazi kwa vijana. So in essence, what I'm viewing this as is, now this is kazi kwa vijana, but it's the funding system that has changed. Then I went further because I wanted to understand more. You do realize that P.S. Zinga's explanation was more than 1 hour, and I'm really slow, so I take time to went further and realized, say, oh, good, this is then a SACCO. That, a national chama, I call it a national chama. Chama, you know, is English for SACCO, I hope. No, chama is Kiswahili for SACCO. Then he goes further and say, you know, but when you want to withdraw it, you'll be taxed. Gerald is a pyramid scheme, and doctors don't want it.
Have they said that? They have told you that?
Yes, yeah. They do not want to contribute money into a pyramid scheme. There's no ifs or buts. That is a voice I heard loud and clear.
Are you sure?
Absolutely.
Katibu.
Yes. I think I listened to
Dr.
Abi,
has
and
painted
the
a-
reasoning is there. We have had advantage of discussing these things as the general secretaries. We were in Kisumu and we discussed a number of these issues. There are things we don't agree. There are things we agree. And it is good to say that this is, what the president is trying to do, we have also tried to context in our own understanding without even listening to him. And we get to understand that in the history, when NHF was starting, there was a lot of grammar, by the way. People were refusing to establish that fund. But today, it has saved very many. And I say that because 3 years ago, my father, who is currently a farmer, he didn't have an insurance, so I put him on insurance, on NHF. So I'm paying for him. Every year I pay full. So last year, 3 years, actually when I started that time, he had started complaining about the issues of prostate. So this year he complicated and he was done surgery somewhere. And it took, so when I did the calculation of what I paid, I realized that if I was to raise that money that he used here in Nairobi, in Medihill Hospital, I might not have raised that money, immediately being an urgent thing. A friend of mine is similarly the same. So you look at what we call pooling, and we want to understand the pooling of resources for benefit of every Kenyan. It's not, by the way, who is contributing to benefit. It's not true that everyone who will contribute will benefit. Because some of us, by the way, have probably, like me, I've never used my NHF for more than now close to 13 years.
So you think you might also not use theirs.
But I know that money has benefited someone because that is the pool that we do. So in this levy, now what we are talking about, the house levy, when we came to it, we looked at it, what is the priority for this government? They are talking about housing. What is the priority of the government? The people we have given mandate to guide the country to prosperity. That is their mandate. But one, we realize in so doing, we have many other issues that we need to be addressed, that Kenyans, majority of Kenyans are grappling with, to put food on the table and to ensure that they are able to get health. Even a number of them also will talk about education, where we are wondering whether these things we call, now we have two systems of education, as we are trying to phase out the other one, we are bringing the other one in. Then Kenyans are like more of, we need really to streamline the main first before we start thinking. Because don't tell me of a house when I'm not able to feed today. So who is going to stay in the house that we want to build? So first thing first.
Listen, even if
and
you're
our
hungry,
discussion and my own honest feeling is that even if these things must be there, let it be for the willing, not forceful. There are people who are willing to do that. Me included, I will go for it if it is there. But it should not be forceful.
Okay, so you're going to contribute.
Forceful where people already, like one of them was giving me a good case, that they have taken loan, they are building home at their village. They are working here in Nairobi. But they live here in Nairobi. Now here they are coding. They are actually they are renting a house, but they are building where? At home. So to that extent, they have taken loan
To build.
as a family. They do not. The money they have is what they can accommodate and push them through that
They rent in that city.
that month before the next pay. You understand? So if you try put any deduction, meaning they will go negative. So there is a policy in government where if you want to take a loan, you can't go below a third. So if you go below, will these people be in arrears or what will it be? So indeed, we felt like this is currently, it is something that we really need to strongly discourage the government from doing, because none of us is really willing to be forced to do what they feel that they do not attest or rather approve of it.
Okay.
Yeah.
All right. Okay, gentlemen. Well, I've had you. Or the people who are supposed to hear you have had you.
Gerald, let me just add on this. First of all, I'll differ a little bit with Katibu. I will not compare NHIF or any health insurance cover to a cover that is building houses, right? For whom we do not know. They're taking money from my payslip, but the agenda for building those houses is not that I stay in that house. The agenda for building that house is so that somebody else gets a masonry job, an electrical job. Kazi kwa vijana.
Is that not building the economy?
Not a bad thing.
No, listen.
Because not all of us can be in the health sector.
No, yes, not all of us can be in the
I do not want
health
to
sector.
condemn them if that is the idea.
The fact that you have
Can I build up my point? Let me build up my point. Okay, maybe in a socialist community, that will be something to clap for. But you see, you take money from someone's payslip who's already committed into a family, and they are not rich. Everyone is struggling in the country, right? They already have commitments made. And you know, this is just something that comes after an election. You are creating instability. In as much as you'll say this is not a new tax, at the end of the day, when the PSA says that they charge interest on it, it's a tax. Let me tell you, things are usually not as black and white as you might assume to be.
Until you get there.
Early on, when the country, before just at the dawn of devolution, I was reading, the most logical thing to increase the revenue for the country would have been to increase pay. But then there came the counterintuitive ideas that instead of increasing pay, why not just abolish it at once so that people have money in their pockets
That they can spend.
and grow the economy, right? So you're building a house for grappling people who are telling you, tuko na kwetu. Sisi tuko na kwetu bwana. Ama sisi hatutaki nyumba bwana. These 54 million Kenyans have been living somewhere. I've not seen 54 million Kenyans in the streets, right? And if it's creating employment for the mason and the carpenter and the person who will make the door, we've been doing that through Kazi kwa Vijana and all those kind of programs, and the government has been funding it.
Well,
so the government should fund it.
Let me ask you, Dr.
Not my doctors.
Dr. What do Masons do?
Masons. Mjengo.
Yeah, so it means there'll be houses. Right?
Sorry?
It means there will be houses at the end of the day.
They'll build houses for who? I have a place I'm living, number one. Number two, if it's really for the hustlers, then you tell me if those Masons will afford those houses.
Okay.
Because Dr. Me and you, yes, you have a roof over your head, so you're building those houses for who?
Yeah, the houses would not lack anyone to get there. To actually, they will not lack. That's for
So
fact.
you're saying it's aspirational?
For me, looking at it, like if whichever they are saying is something to go by, then that's okay. The issue is about looking at how our country has been faring economically, and then we feel that it's not the priority. And why I'm saying that is that as much as I might say I live in a house, I have somewhere I stay, I walk outside and I look people getting into iron sheets surrounded. And
Will they live in those houses?
Let me finish. Let me finish. Yes, if you, and what I have done is that probably to look, and I have listened to what they have been talking about, how Singapore was able to come to that situation, doing the same, pulling together, including Malaysia. Then they came up and they showed that everyone has at least a standard house to live in. Now, when you move around here, Gibore, urudi pande hii, uende, is it Mukuru, Kwanjenga, and kila mahali. Then you look at it, that's what we have in our city. The government need to come up with a strategy, not really to rob people's salary, but to have a strategy to do that. And we need to encourage them. First, we can employ the PPP, that is the public-private partnership, to ensure that they can support the government to come up with those houses. Because the government is saying we will give the land. They are taking away that cost of the land. That is good. The second thing is that the government must tame itself in terms of wastage. Once we tame the wastage, which even the former president declared that we lose 2 billion every day, then we have money enough to raise buildings.
Okay.
So indeed, we are saying there are many ways to raise that fund and ensure that the people they are talking about
Can get houses.
to work, to get houses and to get works to do, they will be able to do that. Then the government, even the government chief economic advisor, David Ndi, has spoken about government waste. So if at all we can be able to look at what is it can we do first before we go to rob people's salary, then that will be okay.
Okay.
Because then you let this one be, it is for the willing.
Good.
Because there is, when you are willing, you go there consented. We have people lose money in pyramids. They consent first before that money goes.
Hata ikienda unajua ni
Yes,
kubali.
when a con man calls you over your phone and tells you press this, you are consenting.
Okay.
When that money goes, yes, you'll say you have been conned, but you consented by pressing, because he never came to operate your phone. So that's what we are saying, that we need the government to have some retrospect into what they are doing. What people are speaking strongly, listen to it. The president promised to be a listening president. He must listen to Kenyans. Kenyans have their views, and their views are valid from where they are seated.
Okay.
Not where he's seated in probably State House, where things have changed. Probably, I believe now he's a dynasty. Because
He's
now
still a hustler.
he is the presidency. I hope Mwachi agree with me now that we were together supporting the president. Yes. No, we were with you somewhere.
I was apolitical.
I can count the number of pilau Mwachi has taken.
Yes,
So you cannot. I can provide evidence on the plate.
Yes.
Yeah.
So the agenda is that we are agreeing that the president could be having a good idea, wrong time, and he need to
Wrong
devise a good
execution.
approach and go for the low-lying fruits before he comes for the people's
For the
salary.
housing.
In any case, let him actually advise the ministries also to implement the CBS and assign the CBS for the workers, so that the workers feel motivated. You're already going for angry people. These are very hungry and angry.
Akona njaa na
Yes.
hasira. Haya. Your tackle of the day, your parting shot, Dr.Abi Mwachi.
Doctors don't want houses. The housing levy is punitive. It's not well thought out. You don't know what PS Child Singer is about. We are already angry people as doctors. We expected a pay raise this year. We did not get a pay rise. We do not want to be put into devolved units that are rudderless. We're just angry people to be overburdened by another 3%. Maybe overreacting about the 3% could be about the other issues. If the president can sort out the other issues, maybe we can sit down and talk about this 3%. But we're just angry people just reacting over everything. And we shall. It's all right. Thank you.
Katibu. Yes. Your tackle of the day, your parting shot.
Yes, my parting shot will be that we have a country called Kenya. We are all Kenyans. Some of us are holding position, not permanently, but for this time. And including the government officers who are in place, we want to believe that we want to do the best thing for this country.
Okay.
Listening to each other and acting as a team is better than when you are pushing people away and attending to consecrate or rather do what you want to do. So for this, I want to say that we want to have a discussion about how to run our health system. And let us go by the history and ensure that some of the issues that we have gone through can give us a lesson to actually undertake a good audit and decide how we want to run our health system. On the finance bill, the clinical officers are opposed to mandatory deduction, forceful. Let it be there for those who are willing, but we really need a clear chartered way in terms of how we need to support, how we need to be supported to do, or rather to support the government on what they need to do. Let them sign our CBS. let them give us what we have been asking for more than 4 years before they come to ask us for anything.
Okay, Thank you so much, gentlemen, for coming in. Edwin Wahome, look for investors to put up their affordable houses without raiding workers' pay slips. All right, it has been the State of the Nation edition of the 30th of May 2023. And we've been looking at the state of healthcare. And of course, we've been having our guest here this morning, Dr.Abi Mwachi, who is the chairman of National Union of Doctors, and George Gibore, who is the Secretary General KUCO, Kenya Union of Clinical Officers. And they've helped us to put in perspective the issues that are in healthcare and what they think will be best for them. And we mentioned that laws are for us, we are not for the laws. So you rightfully say that this is how we want our affairs to be run, not how they want us to be managed and run. And you'd want to ensure that you can leverage and you can control how exactly the medical sector and the healthcare sector is handled by the both national and county government. So if you're, I know government, of course, the opinion shapers who have been listening to us this morning and they've been watching us. So, I mean, the ball is on your court now. And even as you go to engage with the leadership, I hope they get to give you an ear and we can make decisions that are in the best interest of the citizenry. Nasema fahali wawili wakipigana nyasi umia na nyasi ndio sisi. Haya, na pia nashuku ama I'm very sure that even your doctors and the clinical officers, they do side hustles. So if they are farmers, ensure you can tell them to go and buy their animal feeds from Fugo Feeds or Unga Farm Care East Africa Limited. Kama wanachunga kuku, wakisha mpata Fugo layers ama Fugo growers kutoka Fugo Feeds. If they are doing dairy, Fugo Dairy from Fugo Feeds as well. They are doing fish, kama wanajenga samaki, mpata Fugo Tilapia from Fugo Feeds. If they are doing pigs as well, Fugo Pig from Fugo Feeds, ensure that you can not only get healthy animals, but also gives you the guarantee of quality in the market and the safety of the consumers as well. So if you are a smart farmer, ensure that you can get your feeds from Fugo Feeds by Unga Farm Care East Africa Limited. Pale Fugo tunasema malezi bora unapata mapato zaidi. Malezi bora mapato zaidi. Fugo Feeds, malezi bora mapato zaidi. Ensure that you can get from authorized distributors so that you are guaranteed of quality and not the standards of products. Until tomorrow on the CS Wednesday on the issue, a very pretty day. Enjoy your day. This is the tackle and it ends now. We love you and bye-bye.